to show that I'm not cheating. Okay, so I'm going to do my lung and cardiovascular assessment. First thing I would do when I come into the room, or first thing I'm going to do is check the chart. I'm going to come into the room, wash my hands, provide for privacy. I'm going to identify the patient with 2 identifiers. Hi, how are you doing? Can you say your name and date of birth for me, please?
Olivia Skaggs, March 2nd, 1994.
Okay, good. My name is Jordan. I'm going to be your student nurse today.
Okay.
I'm going to do like a cardiovascular respiratory assessment on you. Have you had any issues with your breathing, any shortness of breath?
Nope.
Chest pain or fullness in the lungs?
Mm-mm.
Okay. Like any shortness of breath with activity?
Nope.
Okay. So first thing I'm going to do is I'm going to feel for crepitus and palpate the chest area for lumps, nodules, and pay attention to her face and see if it's painful. I would like to note that her respirations are unlabored. They're not shallow. She's not using her accessory muscles. She's not having pursed lips or cyanosis, so it seems like she's having no difficulties in breathing. So we're going to start here with the fingertips, and we're just going to kind of feel for that Rice Krispie popping underneath. She doesn't seem to show any signs of pain. I'm going to go under here a little bit. Okay. All right, there doesn't seem to be any crepitus or pain, nodule, swelling, anything like that. Felt pretty symmetrical. So now I'm going to go ahead and I'm going to percuss the lungs. And what I'm going to do is I'm going to come to the top of their substernal notch and come down to find that angle of Louis, which I always have difficulty finding. Okay, and I'm going to come over, and that's going to be the second rib, and I'm going to go just below it to find the second intercostal, and I'm going to right there. Okay, so I'm going to place my finger here. I'm going to firmly hit it with my other finger, and I want to hear a resonant sound that kind of echoes, like a hollowy sound. If I hear any dullness, then that could be signs of like something's in there that's not supposed to be in there. And be careful over the breast tissue because you might get your sounds just a little bit diminished. I'm trying to come down to this fourth one here. That's good. Okay, I'm going to have you lift your shirt, please. And right there's the fourth, and we'll come down to the fifth. And you might get a little bit more dullness down here on the bottom of the lungs because you're going to start to come over to some of the organs. Go ahead and lower your shirt for me. Now I'm going to have you turn around, please. And as she's turning, I'm going to note the size that it is on the side. And I'm going to bring it over here and make sure that's about a 1-to-2 ratio. I'm going to have you go ahead and lift your shirt for me, please. So first thing I'm going to do is I'm going to palpate. I'm going to find the spinous process up here. That's my C7-T1, and you want to go on both sides. Okay, and I'm going to walk down and find that first intercostal space in between the scapulas. Walk down a little bit. And as we start to get to the bottom, it's going to get a little bit more dull. You're going to have a visceral sound, or, you know, because you have some organs, or you might hear the dullness from the liver. Okay, I'm going to have you bring your arm back. I'm going to find the bottom of the scapula. Right about there. So I'm going to walk down 3, okay, and I'm going to put my hands here, and I'm going to ask her to take a deep breath in. Go ahead, take a deep breath. Okay, and we had symmetric expansion with the inhalation, which means that they're expanding symmetrically. I'm going to place my hands here. I'm going to ask her to say 99.
99. 99.
And you should kind of feel that vibration kind of diminish once you get towards the bottom. And this is going to check for like any fluids that might be present in the lungs or anything like that. So we've done that. I'm going to auscultate in the same areas that I palpated, except that when I get down here, I'm going to come over to underneath the armpit axilla area. I'm going to listen for one full inspiration and expiration on each area. Okay, go ahead and inhale. And every time I move the stethoscope, and go ahead and just take a deep breath in. Okay, here we are at the T7. I'm going to walk down 3 and listen at the base of the lungs. Okay, I'm going to walk back up to T7 and I'm going to come across, and that's going to put us at T8 on the side. I'm going to take a listen there. Now I'm going to go walk up to T6. Okay, do the same on the other side. Okay, good. So I heard more of like a bronchio sound up here, closer to the apex of the lungs. And then we went into the bronchiovesicular, and then down here we got more of that vesicular sound, which was very airy. You want to make sure that you're doing both sides at the same time so you can make sure that they sound the same. I think we're good with that. You can go ahead and put your shirt back on, and I'm going to have you turn around. And I'm going to, again, auscultate in the same areas where I palpated in the front as well. And I'm going to come up here and find this superior clavicle, supraclavicle little triangle here. We're going to listen here. This is where the trachea kind of bifurcates. So you're going to hear a really strong, like, bronchi sound. Okay, and just find that supraclavicle or suprasternal notch. And I'm going to come down to the angle of Louis, which I can never find. Okay, we're going to come over. Okay, if you'd lift your shirt up for me, please. Okay, good. There was no adventitious sounds. I didn't hear anything like crackles or rhonchi or anything like that. So that is very good. Do you perform self-breast examination?
Yes, usually every time I get in the shower.
Okay, so how often? Oh, every time you get in the shower, so.
A couple times a week.
Okay, good. Have you had any changes?
No.
Any discharge?
Nope.
And felt any lumps or anything like that?
No.
Are your breasts symmetrical?
The left one's a little bit smaller than the right one.
Okay, that's normal. If you're, is it always been that way, or is it recently changed?
It's always been that way.
Okay, good. Okay, so now we're going to move to the cardiovascular. I'm going to check first the carotid arteries. So what I'm going to have you do, I'm going to switch to the bell. Excuse me. Have you had any chest pain lately?
No.
Any tightness of your chest?
Mm-mm.
Any tingling sensations anywhere?
Nope.
Notice any abnormal, like tingling or coldness in your extremities?
Nope.
Okay, I'm going to go ahead and auscultate the carotid arteries. So what I'm going to have you do is I'm going to have you take a deep breath in,
Okay.
and then exhale when I ask you to. First, I'm going to find it. Okay. And it is regular and strong +2. I don't feel any thrill. Okay, go ahead, take a deep breath in and let it out. Okay, go ahead and breathe. I didn't notice any bruise. I'm going to check the other side. Take a deep breath in, release it and hold it. Okay, good. Go ahead and breathe. I didn't notice any bruise on that side either. It sounded very good. So now I'm going to check the heart. And what I'm going to do is I'm going to find that angle, that notch again. I'm going to find the angle of Louis, and I'm going to walk over to this right next to the sternum in that second intercostal area. That's going to be the aortic valve. And then I'm going to walk over to the left side. It's the pulmonic valve. I'm going to walk down to the third one right there next to just left of the sternum. That's going to be our Erb's crest. And then I'm going to come down to the fifth one, just left of the sternum. That would be the tricuspid valve. And then I'm going to come over mid-clavicular, and I'm going to listen right here to the bicuspid, or the mitral valve. And when I come here to the mitral valve, I'm going to listen and compare the carotid artery for that PMI. And normally right here, I would listen for a minute, but given the time constraint of the video, well, I'm just going to listen for a couple seconds. And if I have difficult hearing the heartbeat, I am going to ask her to hold her breath as I move, but we'll see if we need to do that once we get going. So find that notch, come down. Okay, go ahead and lift your shirt for me. There's the third, the fifth one. And I'm going to come down mid-clavicular. And here I'm going to feel the carotid artery. And they do seem to be in sync, so that is a good thing. Now I'm going to look at the extremities. And when I'm looking at the extremities, what I'm looking for is I want to make sure there's proper hair distribution, so that way we're making sure that the circulatory system is working. Her skin on her chest and on her arms right now are warm, they're dry, there's no lesions or anything like that. I'm going to test for her cap refill. And it is less than 3 seconds. So I'm going to come over here on this side as well. Okay, I'm going to feel for her brachial pulses. And when you do this, sometimes you got to get in there a little bit and move the bicep muscle over, but you don't want to push too hard because you might obliterate it so you can't feel it. So I'm going to try to get in here and, okay, it is a +2 and it's strong. I'm going to come back over here on the other side and make sure I feel the same. Okay, that's good. And I'm looking at both of her arms right now. They are equal. They are symmetrical. One's not bigger than the other. So I'm going to test for the radial pulses at the same time. Okay, they are +2 and regular. Same, the brachial ones were +2 and regular. Go ahead and lie down for me. Make sure you can see her legs. Okay, I'm going to have you bend your knee up, and I'm looking for the popliteal, which is sometimes behind a ligament here. So you got to kind of move around and get in there and try to feel for it. Okay, that is a +2 and strong. I'm going to come over here to the other side. Okay, +2 and strong. I'm going to come down here to the feet, and I'm going to look for this pulse, tibial pulse, and it's behind what I like to call the inner ankle, which is not proper medical terminology, but I can't think of what it's actually called right now. So I'm going to feel both at the same time, and they both are +2 and strong. I'm going to come down here to the dorsalis pedis and kind of lay my hands here, see if I can't feel it. Okay, so it does run down this tendon right here, and I do feel it on both sides. I'd say this is more like a +1 and regular, so that could be because she's been sitting down. Her feet are a little bit cool, but the rest of her legs are warm and dry. There's no lesions or anything. I do not see necessarily hair distribution on both of the legs because she does shave, but I see the pores here and they do look even. So I'm going to check for edema. And she doesn't seem to have any, which is really good. I'm going to check the cap refills in her toes. They are painted, so what I'm going to do is I'm going to push on the top of the toe and wait for it to come back. And it does look to be less than 3 seconds. Good. Okay, it looks like she is all set, and I believe that concludes my video, so thank you.